Hi, good afternoon, everybody. Welcome to today's workshop. My name is Cassandra Etienne, Associate Director of Business for Cooperative Media. Today, we're talking about using public data to report on rising healthcare costs in New Jersey. We're pleased to welcome back Stella Mach of Branch 4 for another data training. This time, we're getting into data and potential story angles for reporters covering rising healthcare costs and insurance coverage in the state, and what these trends mean for local communities. I'm sure Stella has some, interactive or engagement sections or portions of the presentation. So feel free to come off mute and ask the question or, answer at that point. You can also feel free to drop your questions in the chat, and we'll do our best to get to them in our time together this afternoon. With that, I'll turn it over to Stella.
Thanks so much, Cassandra. I'm gonna attempt to share my screen now.
Yeah.
Perfect. Okay. Well, hi everyone. I am Stella Mach. I'm the founder of Branch 4, a 501c3 nonprofit innovation hub that advances local journalism through data, technology, and AI. So I'm excited to partner again with the Center of Cooperative Media for another data-driven webinar. So this webinar will give an overview of the healthcare cost landscape in New Jersey, including, the federal policy changes, which I'm sure most of you are aware of, premium increases, and enrollment changes so that you can publish high impact stories for your covered areas. So after the webinar, we'll send you the slides, all the data, and, my contact information. So you can start drafting stories, and, you're free to reach out to me for any questions on the data, and I can provide, context and help you out. So a little bit about Branch 4. We are a 501c3 nonprofit innovation hub advancing local journalism through data, technology, and AI. Our core program is really our local data lab, where we provide small newsrooms a full data and tech team to support investigations, data-driven stories, and build digital products. So our outsourced teams, they're really a fraction of the cost of hiring in-house technical staff. And they're made up of talented volunteer coders who are, really passionate about supported local journalism. Our teams work directly with newsrooms to do all the analytical work. So from, identifying data sources, pulling and cleaning data, drafting analytical findings, and creating compelling visualizations. With all of the data work being done, the newsrooms can really focus on, talking to sources and writing the story. Newsrooms apply for a 3 to 6 month collaboration, and applications are opening up soon for the fall. So in addition to our local data lab, Branch 4 provides free resources like this training and open source code so that newsrooms can improve their tech skills and tech infrastructure. If you want to learn more, please visit our website and social media to stay connected with us. All right, so for this webinar, we will answer 3 core questions on healthcare costs. So first is really, why are healthcare costs rising? We'll look at factors that are impacting the costs nationwide, not just in New Jersey. Second, we want to answer how much have New Jersey healthcare costs risen. So we'll analyze the premiums in GetCoveredNJ. And third, we'll answer, how have costs impacted enrollment? We'll look at how GetCoveredNJ enrollment has changed and which towns are most impacted using census data. And at the end, we'll provide, potential story headlines and have time for questions. And of course, throughout the presentation, feel free to stop me if there's any immediate questions or anything is unclear. All right, so let's get started. So why are healthcare costs rising? So it's important to remember that there are, a lot of different reasons for why costs are increasing. And a big one is really the changes in federal policy. So this slide has a summary of changes in federal policy. So specifically, the One Big Beautiful Bill was passed in July of last year. It made a lot of changes to the health insurance marketplace and Medicaid in an effort to cut federal spending. So the changes will slowly be enacted through 2028, with the first change that happened in January of this year. So, the immediate impact, it really, varies from each change. But, the long-term impact, right, studied by researchers is that, the overall cost of healthcare will increase, right? The expectation is that people will pay more out of pocket for healthcare. That's what the research shows. So in January of this year, the enhanced tax credits for the health insurance marketplace passed by the Biden administration, they ended. So enrollees of healthcare.gov and state-based exchanges like GetCoveredNJ, they paid higher premiums in 2026 enrollment, and they will pay higher premiums going forward. And in October of this year, so coming up pretty soon, there's some non-citizen immigrants won't be able to apply for Medicaid anymore. So specifically, groups of people like asylum seekers, refugees, those with temporary protected status, etc. And starting in January 2027, there are two big changes on Medicaid. So first is that Medicaid redeterminations, they'll switch from every year to every 6 months. And the Medicaid work requirements will be enacted. So the immediate impact from these changes is that people will likely, they'll lose Medicaid coverage. And, there's different long-term impacts, but for the cost, the expectation is that costs will increase in the long term, right? So one of the reasons is because, uninsured patients will, they still need care. So they still are going to go to the hospital. But, as hospitals deal with this higher cost of uncompensated care, those costs could shift to insured patients. And, as people lose Medicaid coverage, usually uninsured patients, they tend to forego like preventative care, right? And they get medical treatment when it's really severe. And with these really severe treatments, then that increases the cost of providers, which again, could be shifted to insured patients. And then in January 2028, there's also two other federal policy changes, so they'll be enacted. So one is that the maximum threshold for state-directed payments to Medicare plans is lowered. And for states like New Jersey that expanded Medicaid under the Affordable Care Act, they will have to lower their provider taxes, which help fund Medicaid services. So, both these changes, they result in less funding for Medicaid services, which, for hospitals that heavily rely on Medicaid funds, it really impacts them. So in the long term, right, we have these healthcare providers, they could increase costs, right, as hospitals close down, and the remaining hospitals, they have more market power to charge higher prices. So a lot thrown at you, a lot of information, but I think it's very important to have really the background context as to why, what's happened recently in the federal policy space, and understanding really why costs are increasing, because it's affecting a lot of people, and readers want to understand what's happening. And so it's important to understand that there are a lot of changes in the federal policy space that are expected to increase healthcare costs, but there are also other factors that are pushing up the cost of healthcare. So specifically, first, we have that, people in the US are aging, right? So, in 2004, the share of Americans that were 65 and up was about 12%. And in 2024, it's 18%. So as, the boomer population shifts to retirement, And people are having less children. America's aging, and with people that are older, there's more claims that are being submitted and more expensive care that needs to be done. Second, there's GLP-1 drugs like Ozempic and Wegovy. They're becoming more widely used, but they're expensive. And health insurance costs, they'll likely go up to cover these drugs. Third, there's labor shortages at a lot of healthcare providers, where there's a shortage of nurses, shortage of doctors. And then lastly, there's just general, inflation, I think, as everyone knows, and just a lot of economic uncertainty due to, shifting trade policies at the federal level. So, with all this information, I really want to emphasize that 2026 is really just the start of large increase in healthcare costs. Really just the start, because, the federal changes, but then also these factors. So, as more of these federal policy changes take effect, so specifically, cuts to, Medicaid, costs are expected to increase. So this graph is from the Kaiser Family Foundation. It shows the actual and projected total health spending in the US from 2018 to 2033. So as you can see, the dark blue line, that's the total costs. They're expected to increase. And all the lines below that, so like the pink, the light blue line, the green line, the cost is also expected to increase in every underlying category. So like hospitals, physicians and clinics, and prescription drugs. So numbers wise, in 2025, the projected total healthcare spend is 5.6 trillion. And by 2033, it's projected to be 8.6 trillion. So, from 5.6 to 8.6, it's a 45% increase in health spending in just 8 years. So huge increases, and it's unfortunately only going to get worse. All right. So with this background of healthcare costs increasing nationwide, let's take a look at New Jersey. So before I dig into the data, since this is a data-driven webinar, I want to provide a list of public data sources for healthcare and health insurance coverage. The Kaiser Family Foundation is a nonprofit organization doing research on healthcare policy. They're not affiliated with the Kaiser health insurance provider. So KFF for short, they have really, really great data and research at the national and state level on really all things U.S. healthcare policy, understanding why costs are getting expensive, tracking costs, the implementation of, federal changes, etc. Really, really great resource. And then there is the Center for Medicare and Medicaid Services, or CMS for short. So because Medicaid and Medicare, they're federal government programs, CMS has like a wealth of data, just a wealth of data on really all things in those programs in terms of like, hospice enrollment, rural health care centers, Medicare Part D prescription costs, just a lot of data. And under CMS, there's, specifically for the healthcare exchanges, there's, pretty useful information. So one is the Marketplace Open Enrollment Period files. So this has data on enrollment, plan type, premiums, enrollee backgrounds at, the state, county, and even at the zip code level. But important to note, the data for the zip code level, it's only available for states that are on the, that use healthcare.gov. So like New Jersey is on a state-based exchange. So, zip code and county level is not available there, unfortunately. But for those not in New Jersey, there's amazing data at the county and zip code level, which is, super helpful for telling local stories, like really, really local granular stories about healthcare costs. And so CMS also has data on effectuated enrollment, which is another method of tracking healthcare coverage, and I help slide on this later. In New Jersey specifically, there is the Department of Banking Insurance. So that site, it has data on New Jersey enrollment, the health insurance plans, and base premiums for GetCovered New Jersey. And then lastly is my favorite, is the Census Bureau American Community Survey. So it has a lot of tables on like health insurance coverage and type by age, race, sex, at the national level, really going down to very small geographic levels like the neighborhood or the block level. All right, so the rest of the slides are really focusing on GetCovered New Jersey. Since the tax credit were recently removed, and there's just a lot of publicly available data for the state-based exchange compared to employer health insurance plans. So for GetCovered New Jersey and other health insurance marketplaces, it's important to remember there's like two premiums that people see when they're shopping around. So on the one side, there's base prices that health insurance companies charge for their plans. So these are the monthly premiums before any tax credits are applied. And then, there are premiums after the tax credits are applied, which is the actual monthly amount that enrollees pay. Like two different numbers. So, this slide and the next, we're really going to focus on the base premium. So like before any tax credits are applied. So this graph here, it shows two lines. So the light blue line, we have the year-over-year percent increase in the base premium for individuals. The data is from the New Jersey Department of Banking Insurance. And for comparison, we have this dark blue line, which shows the year-over-year US CPI inflation. So, in the table, you see that from 2021 to 2024, the base health insurance premiums, the increase followed pretty closely with overall inflation. But then in open enrollment 2025, it starts to diverge. And then in the most recent open enrollment, base premiums, the increase really skyrockets with a 16.6% price increase year over year compared to overall inflation of 2.7%. So, as you remember from previous slides, the only federal policy change only the first federal policy change was enacted, and base prices have already jumped substantially, right? So, there's other factors that are contributing to the price increase, right? Aging population, the GLP drugs, economic uncertainty, but also, along with the tax credits. So, insurers, with the cut in tax credits, insurers expect healthier enrollees to drop out of the marketplace due to higher premiums. And so if you have less healthy individuals in the pool, in the marketplace, they have higher healthcare needs. And so with higher healthcare needs, then, premiums will increase to, get enough more coverage for them. All right, so this table, it shows the increase in monthly base premium from 2025 for the median GetCovered New Jersey plans in each metal level. So to calculate these numbers, I used the base premium data from the New Jersey Department of Banking Insurance. I took the median plan in each metal level, and I just calculated the difference in the base premium between 2026 and 25. So the numbers here are really the price increases per person and per month at each age level. So I think for those that cover healthcare, that the health insurance marketplace, it has different plan tiers with varying levels of copay, deductibles, etc. So the gold level, it has the lowest deductible, but has the highest premiums, along with the silver plan, the bronze plan, and then the bronze plan, which has the highest deductible, but lower premiums. So, just looking at the table, we really see that the base premium increases it depends a lot on age, right? We have the older enrollees, they face much higher premium increases than the younger enrollees. In 2026, the premiums increase, generally for all the plans, with the gold plans seeing the highest increase. So, for example, the median base plan increase is around $400 if you're $50 or older, $400 plus. And then the bronze plans had the smallest base increase, ranging from about $20 if you're 20 years old to around $80 if someone that's 65 and up. And then also calculated from the New Jersey Department of Banking and Insurance is this table that shows the 2026 base premiums for the median plan per person per month without the tax credits. Again, so no tax credits here, just the base premiums that the health insurers on GetCoveredNJ are charging. So again, the cost, it varies pretty widely depending on the metal level and the age, but overall, they're pretty expensive. If you're, for example, if you're, a married 30-year-old, the base premium is around, $860, right, for you and your spouse total under the bronze plan. But under a bronze plan, remember, they have high deductibles. So you still have to pay a lot out of pocket for health insurance. And, the prices are higher as you get older, right? When you're 65, it increases substantially for across all of the metal levels. So, just looking at these base prices, you really get a sense of how important the tax credits are in allowing enrollees to afford health insurance. All right, so this slide, it looks at the other side of the GetCoveredNJ premiums. So remember, there was two sides. One where the health insurance companies, it's the base premium they charge. The other one is, after tax credits, that's how much people actually pay for the premiums. So this data is from CMS, the Open Enrollment Public Use Files. So if we include the advanced premium tax credits, the average monthly premium per person rose from about $179 to $277 in 2026 open enrollment, which is about an increase of about $100 per person per month. So, if you're a family of 4, you're paying about $400 more per month for health insurance in GetCoveredNJ, which, if you're a family with tight finances, $400 a month can really be a lot. It can really strain families. In 2025, there were about 100,000 enrollees that paid less than $10 premiums after the tax credits. But, with the decline in tax credits this year, the number of enrollees that pay less than $10 per month, it shrunk to around 20,000 enrollees. So it's about an 80% drop. All right, so for this last section, we're really going to focus on how costs have impacted enrollment and which New Jersey towns are most impacted by the health insurance marketplace changes. So here we're showing the enrollment level by metal level for 2025 and 2026 open enrollment. So as you remember from the previous slides, the gold medal level, it has the lowest deductible, but it has highest premiums. Then, it goes to the silver plans and then the bronze plans, which have, high deductibles, but lower premiums. And there's even what they call a catastrophic plan, which, has the lowest premiums, but typically reserved for people under 30 for, these catastrophic events. So with the tax credits ending in the 2026 open enrollment, we really saw pretty stark changes in the plans that people selected. So first, the open enrollment, if you have 509,000 compared to 513,000. So the enrollment dropped by about 4,000 people this year. So, 4,000 people, it might not seem like a lot, but it's important to note that enrollment in Get Covered New Jersey, it had been steadily increasing from 2021 to 2025. And so, the drop in 2026, it's a reverse in the progress that New Jersey was seeing for healthcare coverage. And then second, we see that a lot of enrollees, they switched to a lower level plan. So specifically, a lot of them switched from, silver to bronze. So the 2026 silver enrollment had about 50,000 less enrollees, and they seem to have switched over to the bronze ones. This one increased by about 50,000 in 2026. All right, so we know that about 4,000 less people selected plans in the open enrollment for Get Covered New Jersey. But it's important to note that, the enrollment numbers during the open enrollment period, that's only one way of measuring healthcare coverage in the marketplace. There is another way of measuring healthcare enrollment, and that's called the effectuated enrollment. And the data is provided, or this data here is provided from CMS. So the effectuated enrollment, it's the number of people on a healthcare policy and they paid that month's premium. So this number, it really reflects the reality that some enrollees, they're unable to keep up with monthly premium payments, and later in the year they drop out of coverage because they can't keep up with the payments. So this graph, it shows the 3-month average effectuated enrollment for Get Covered New Jersey, whether if it was through healthcare.gov or Get Covered New Jersey. And it shows it for the period between 2016 and 2026. So from 2016 to by the end of 2020, we see that the effectuated enrollment, it kind of lingers around 200,000, 250,000. And then there's these bumps here, for each year. Those are January. And then they slowly decline because people can't keep up with premiums and they drop coverage. That's what we're seeing with these bumps here. And then from really 2021 to the end of 2025, you see this huge increase in enrollment. So in January 2021, the effectuated enrollment was about 230,000. And then by December 2025, it more than doubles to around 500,000. So I think, for someone that's in healthcare policy, people would call that a success, right? You have more than double the number of people in the healthcare coverage. Then in January 2026, we see this shaded red area. There's a drop in effectuated enrollment. So from December to January, the effectuated enrollment dropped by about 60,000 people. So, putting everything together, in the previous slide, we saw that about 509,000 people, they selected a plan in Get Covered New Jersey, but about 60,000 people have already, in January, about 60,000 people already dropped from the plan because they couldn't afford the new higher monthly premium. All right, so using census ACS data on health insurance type, this map, it looks at the New Jersey municipalities that are most impacted by Get Covered New Jersey changes. So specifically, it shows the average number of Get Covered New Jersey enrollees from 2020 to 2024 with ACS data. So as you see from the map, these dark shaded areas, they're the most impacted towns. They're pretty geographically dispersed, right? They're not like focused in like one specific area in the state, but they're, located, they're dispersed pretty widely across the state. So Jersey City and Newark, being huge cities, they're unsurprisingly the most impacted. But there's also, small rural towns that are more heavily impacted too. So like Middletown and Berkeley. And then also using data from the ACS. So this table here, it shows the top 10 municipalities with the most enrollees in Get Covered New Jersey and their socioeconomic makeup. So, there's a lot of data in this table, but, a big takeaway, at least from when I was looking at it, is really, there's, a lot of towns are impacted by, the changes in the healthcare marketplace. And, they don't follow a specific income or racial makeup. For example, if we look at Newark, it's second on the list. About 24,000 residents in Newark are in Get Covered New Jersey, about 8% of the town. And, the city has a high poverty rate, and it has a very high Black and Hispanic population. So that's one town, it's one city, it's Newark. It's, very interesting in terms of demographics and socioeconomic characteristics. And then we look at Toms River, right? It's fourth on the list. So about 14,000 residents are on Get Covered New Jersey. But the town is, very different, right, than Newark. So, it has a low poverty rate, and it has a very low Black and Hispanic population. So, just, looking through the towns on the list and really looking at their socioeconomic makeup, the table really just dispels, any myths out there that there are only, certain groups or certain areas that are impacted by the changes in the health insurance marketplace. I mean, that's just not true, right? You have people really across New Jersey that are impacted. And, as changes to Medicaid are enacted in the coming years, all of us will be impacted in some way, right? Whether it's through higher premiums, higher or longer wait times, higher out-of-pocket costs, or hospital closures. I think all of us are impacted. All right, so this slide, maybe the most fun for the journalists on the call, on the webinar, is potential story ideas from data and information from the slides. So one is, I think, pretty self-explanatory, is just having an explainer, right? Think about, here's what to expect this open enrollment based on last year's numbers. So just a practical guide to help, readers understand their budget and choose plans wisely. Another idea is, really looking at the, one of the top 10 towns, track how premium increases are hitting specific neighborhoods. Interview the residents to really show the human cost behind the numbers, because obviously numbers tell one part of the story, but talking to, the residents in different neighborhoods to really see how it's affecting them in their daily life. Another idea is doing a deep dive into stories that have into towns that have a high percentage of residents on Get Covered New Jersey. So in the top 10 towns, the highest one is Cherry Hill, 15%, but there's a lot of other towns that have a high percentage of residents that are on Get Covered New Jersey. I mean, there's some as high as like 30%. And so, potential idea is, for some of these small towns, really, talking to community members and the town officials to see, how they're adjusting to the increases, but also preparing, as premiums continue to rise in the future. Another idea is framing it in terms of, dollars. So the premiums, after-tax credit premiums, is about $100 more a month per person that families are paying. So you can kind of frame the $100 as what it really means for a family. Interviewing families, really asking about how that impacts their finances and if they have to make any, changes in their family, whether it's like skipping bills or second job because of the increased costs. Another idea is talking to the providers, right? Because that's a really different perspective. And as a lot of, these costs play out, specifically the Medicaid cuts, understanding how healthcare providers are, dealing with the changes, what they expect, and, how they're preparing in terms of, any changes to services, costs, care quality. And then I think maybe my favorite is who gets left behind. So as you remember, in October, so just a few months from now, certain non-citizens, they won't be eligible for Medicaid anymore. And, for this, you can ask or talk with local healthcare providers, right? Specifically, community health centers that cater to these populations. Really asking them, what they expect, how they're anticipating the change. Yeah. All right. So that is all I have. Thanks for listening. Opening up the floor for any questions.
Thanks, Stella. I see earlier on we had a question from Steve that talked about healthcare providers. I wonder if you could jump into that, seeing as how the last two story suggestions kind of deal with those kind of angles or looking at it from their perspective. Steve, do you want to come off mute and ask your question, or do you want us to just read it out loud?
Hi, this is Steve Gardberg. Can you hear me?
Yeah.
Hi, thanks. I'm the school business administrator for Boonton Public Schools in North Jersey. And I happen to have a strong appreciation for the local media. I studied journalism undergrad, worked in that for a while. But one of the things I don't see covered so much, but definitely impacts us is like how the costs itself have grown so much, which then drives really the premiums. So there's a lot of consolidation in the last couple of years among healthcare providers, hospital networks, and they seem to have more negotiating power to get higher payments from the insurance carriers. So I think that's sort of a big important piece to understand and be able to communicate to the public. What do you think about how that's impacting real life and how we're covering it?
I mean, I think that's a great story idea, right? So talking with, so for example, so I'm actually based in Massachusetts, and there's a lot of health or hospitals that have closed down recently. It's gotten pretty big coverage on the news, but I feel like those hospitals, the coverage at least I see is really like panic mode. It's like, this has happened. What are people going to do? But like, I feel like what's less covered is like kind of what led to it, and then how does that impact like costs going forward.
Yeah.
So I totally agree that
Again,
it's something that I think should be covered because, as I mentioned, it's like, a lot of these changes, they're impacting, certain people directly, but like overall, as all of these changes kind of roll out, like all of us are being impacted, right? We'll face higher premiums, we'll face higher, out-of-pocket costs.
because then what's the ripple effect of premiums increasing to employers like public school districts or towns, increases of 25-30%. That's absolutely leading to reduction in headcount. So that's fewer people having jobs and then having their health care covered.
Yeah.
And I don't know that I'm seeing that in the news very much.
Yeah, no, I definitely agree. So the slides I prepared, it was really focusing on the costs on individuals.
Mhm.
But for For New Jersey Department of Banking Insurance, they also have data with premium increases for like small businesses. So, the data is there in terms of you can look at how, the premium increases have changed over time. And there was also a huge jump for small businesses. I think it was like 16% as well in 2026. So, on the business side, they're also facing higher healthcare costs. So the data's there. I just didn't cover it because I thought that the human or like the resident level was more interesting, but it's there.
Thank you.
Mm-hmm. Cassandra, did you say there's another question?
That was the only one in the chat, but I can also ask a couple of questions myself. I know that pretty much we saw that the trends that you highlighted for us show a dip in enrollment, and you talked about some of the factors that have led to that decrease. I wonder, was there anything that you found in producing these data sets that was surprising to you?
I think, let me go back here. I think this is most surprising. I mean, I personally I've never used the insurance, like the marketplace. So I get my insurance through an employer. And so, I see certain costs, but then I have heard that the cost on the marketplace is pretty high. But then when I really, looked at the data, it's like, these are really high. Like this is like no joke. This is really expensive. Again, pre-tax credits. Remember, pre-tax credits. But like, the base is like really expensive. And so for the health insurance companies, they have again the base fee, but then there's an age factor that they multiply the fee by. So like, let's say for example, for I don't know, a bronze plan, it's like $200. And then you multiply that by the age, by a certain age factor to get the actual premium. And it's, if you're 65 and up, you multiply that amount by 3. and if you're like under 20, you multiply it by like less than a factor of 1. But like, for me, it was just really kind of wild in how the pricing is, where it just increases so much by age. Like you can slowly increase it. And 65 plus, you multiply by 3 times. So that was, I think, pretty wild to me.
Great, and thank you so much for sharing the data with us. I'm doing another call out for questions. In the meantime, I can also ask another, unless Stella, there's something that has come to mind that you'd like to highlight.
Let me think here.
I guess as reporters, find and sort through this data, can you talk about ways they can distinguish between changes caused by, I know primarily these are caused by changes at the federal level, but you know, based on the data sets that are available, how can reporters kind of distill the information as to the impact at the state, county level?
Yeah, so the data, let's see here. Good. This one, oh no, sorry, this data. So unfortunately, like all of the data, at least all the data I found there's the New Jersey Department of Banking Insurance, and there's CMS. So all of that data is at the state level only, unfortunately. Like I was trying really hard to dig in to see data at like the county or the zip code level, but it's not available for New Jersey.
Got it.
On CMS. So CMS, it has that data, like the county zip code level, but it's only for states that use healthcare.gov, like the federal marketplace. But New Jersey uses GetCoveredNJ, which is a state-based exchange. And so, there's not that super granular data at the state level. So again, if there are listeners not in New Jersey, the, other states have, or other states, you can see the data at like the county and zip code level, which I think it's super fascinating to really see how it changes within these small geographic areas. But unfortunately, it's not available in New Jersey. Potentially FOIA, but potentially FOIA though for New Jersey Department of Banking Insurance. They might have it at like more granular levels.
Okay.
Yeah.
So I think as I was asking my question, you were going to highlight another point for us, or were you going to show us something on one of the slides, Stella?
Yeah, I think what was really interesting for me was, actually, I think this one. I think I really like this one. So basically, again, looking at the most impacted towns, right? So calculate just by the number of enrollees, and then so sorted by like the town with the highest enrollees. Yeah, I mean, I think it really highlights that not only one area or not one population that is impacted by the changes to the health insurance marketplaces and just rising healthcare costs overall, right? So like these towns are very different geographically, in terms of demographics and like their income levels, but they're they're on the top list of those that are on Get Covered New Jersey. So again, it really just highlights that a lot of towns all over New Jersey are impacted by this, and as the Medicaid cuts start being enacted, then I think that's really going to show similar trends, right? Like it's not only certain areas, it's not only urban areas that are affected, but it's really all across the state that are being affected.
Thank you, and I appreciate that insight and clarification. Okay, so we're at 2:50. We have about 10 minutes left if anyone wants to come off mute or drop any questions in the chat. Stella, I guess if you want to remind folks if they have follow-up questions, how they can reach out to you. And also these speak to whether these slides we'll be able to share them with attendees.
Yes, so we'll share the slides, and there's also I have like an Excel file with like all the data, and for every single municipality in New Jersey, it has like the number of enrollees, all this data here. So you can also, if you're looking for a specific town, then the data will be in there as well. And my email address will be sent out as well. So feel free to email me for questions.
Okay, great. Well, Stella, thank you again for hosting this training. As she mentioned, please reach out if you have further questions. But on behalf of everyone at the Center for Cooperative Media, thank you for joining us this afternoon for this presentation. And we'll be in touch and follow up with the materials and resources from today's webinar. Thanks, everyone.